Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's COVID-19 news conference for the latest in COVID-19 information for the Amarillo community. Once again, we do these every Wednesday at 11 a.m. Let me go ahead and introduce who is on our panel today. We are joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Emmentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. What we'll do is we'll open it up to statements from our panel, and then we'll take questions from our media members. We'll start with Amarillo Mayor Ginger Nelson. Mayor, how are you today?
I'm doing well, Dave. Thank you. I know we're all watching the transition of power in Washington, D.C., so appreciate that you would give us a little bit of your time and attention this morning. All of my questions from citizens are really surrounding vaccines. So Casey, I just have two questions for you quickly this morning. Can you tell me exactly how we as the city know when vaccines are on the way?
So we have we get an email the day before we get the vaccine. The day before vaccine arrives, we get an email from the state notifying us of how many doses we get. We also, there's a computer system called VAOS that we're able to log into, and that computer system allows us to see how many doses have been allocated to us for that week. And that is usually populated just maybe a day or so before we receive that allocation. And so it's a very short notice. We have a very flexible and nimble team, a very flexible and nimble state. And so we appreciate having about 24 hours notice before we get that vaccine.
And how are they shipped? Like, do they come by a private shipping agent, UPS or FedEx?
Yes, so the vaccine is shipped to us through our normal channels. So the way that we get all of our other vaccines is through the distributor, through the distribution channels. And so it would come through those regular shipping channels, either FedEx, UPS. So the way that we normally get vaccine.
Okay. Thank you for taking time to answer that. I know you and I've talked about it, but it's great for citizens to hear the answer come straight from you and your department. Dave, that's all I have this morning.
Thank you, Mayor. Let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you?
I'm well, Dave. It looks like I had a little bit of trouble with that word distribution, and so I'm going to try to avoid that word the rest of the day. But so we'll kick it off and talk about our numbers this morning. As of yesterday, we have a total of 31,168 total cases of COVID-19 here in Potter and Randall counties. In Potter County, we have 15,999 total cases of COVID-19, and in Randall County, 15,169 cases. That leaves us with 27,461 recoveries, and we are thrilled about each and every recovery. And we do have 561 deaths to report today. That leaves us with 3,146 active cases. Each of the cases do represent a unique individual. The total rolling 7-day positivity average for Potter and Randall counties is down to 8%. And the positivity rate at the drive-through testing site, it remains about 31%. The 5-day new positive case average is around 143 new cases per day. So we appreciate you all wearing your masks, social distancing, hand washing, and being vaccinated. Those are the things that's what we have in our tool belt to fight this virus right now. The public health drive-through does remain operational, and you can continue to call 378-6300 to be screened and directed to the test site. Our outpatient bamlanivimab infusion center is also operational. So if you have just been diagnosed with COVID, please talk to your physician or your healthcare provider about a referral, as we are receiving referrals for to be able to treat patients through that bamlanivimab infusion center. GA32's hospitalization rate for the 25 county Panhandle RAC region, we're in that region A. We have been over the 15% threshold for over 3 months now. Yesterday, our RAC percentage was at 19.55%, meaning that just over 19% of all hospitalized patients have COVID-19. We do have some information on the vaccine front. So as of today, Amarillo Public Health has given much of the vaccine that has been supplied by the Texas Department of State Health Services. Our clinic at the Amarillo Civic Center is currently open and wait times are short. So if you haven't been vaccinated and you're in 1A or 1B, a frontline healthcare worker, or you have a chronic healthcare condition, or you're over the age of 65, please come see us to be vaccinated. We have received so far to date we have received 23,000 doses of vaccine. And we started this morning off with 1,400 doses of vaccine. So you can see we've given a lot of vaccine through the clinic there at the Civic Center. Please stay tuned to AmarilloAlerts.com, and we will change the indicator there on that website to unavailable as soon as we have exhausted our supply of vaccine for this week. As far as second doses go, there has been no official policy change from the state. And so we expect our second doses, our rounds of second doses to be given as planned. Our first clinic was December 28th. And so that first round of second doses will begin early next week and will continue as planned. There's a minimum of 28 days that has to pass between doses. So one of the new features of AmarilloAlerts.com is a date checker. So right under the vaccine availability indicator is a note stating that if you received your vaccine on or before the date that's noted, then you're eligible for the second vaccine. So the note is specific to the Moderna vaccine that we're giving here at the city's clinic at the Civic Center. So be sure to check that out. If you received your first dose, look at your card. So I've got a copy of a card here. The date will be written here in this middle column, and be sure to check that out and check that against the date checker that's on the city's website, AmarilloAlerts.com. It'll have the date that you need to be on or before so that you can receive your second dose. Our team is excited about giving second doses next week. And again, it's important that you bring your card with you to the clinic at the Civic Center so that we know when you received your first dose and when you'll be eligible to receive your second dose. It'll speed up the process for you so that you can quickly get your second dose. So don't forget, 28 days, that's 4 weeks on the calendar between doses. And don't forget to bring your card back. And that's all I have today, Dave.
Casey. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Hey, good morning, Dave. So, well, once again, I am humbled by the power of Mother Nature. So yesterday marked the 1-year anniversary of the first confirmed positive COVID test to a case in the United States. Here we are 366 days later. We've had over 400,000 Americans lose their life to this virus. We've had over 2 million people in the world die from this virus. And I do think that the memorial last night down in Washington, D.C. was very touching to try to memorialize all those people that have lost their lives with this virus. Now, in that same year, we've also developed 2 vaccines between the efforts of the government and private industry. That is absolutely stunning and incredible technology. Now, not unexpected, we are seeing this virus start to throw curveballs at us, and that's what Mother Nature does. So you're hearing more and more about these variants or what might be described as mutants of this virus. Now, there was a report that came out this week about the UK variant, which is this B117 variant, which we know with the virus is not more dangerous, but it's way more infectious because of the mutations it now has. The reports this week say that the current vaccines will cover this particular variant, and this variant has now been identified in 60 countries. I think the more concerning one is the one in South Africa. There's a variant there which now they're showing that the vaccines may not be as effective as we like against this variant. So the take-home message is the only way to stop these variants, the only way to stop these mutations is to shut down the reproduction of this virus. A virus cannot mutate if it doesn't reproduce. So again, it's important for all of us to get the vaccines as they become available. But even more, as Casey pointed out, it's critical we do not let our guard down. We have to do the same things we've been talking about for almost a year now. Masks, distancing, hand hygiene, and all those other things that protect us from getting this virus so we can shut down its reproduction. Let's talk about the numbers at Northwest. So right now we are at 52 positives in the hospital. That puts us at 10.5% of our licensed beds. So that's fantastic. That's way below that 15% the governor draws as the critical line. We have not seen this number, this low number, relatively low number in the hospital since mid-October, over 3 months ago. So that's good news for us. Now, that being said, is we did have a rough weekend last weekend in Northwest. We had 10 individuals lose their lives because of this virus. So right now we were at 40 deaths for January. And hopefully we will stay below the 70 plus that we saw in November and December. Now, right now, we have 55 people in the ICU, 26 of which are COVID patients. And out of the 18 ventilators that we're currently using, 8 COVID patients are on those ventilators. So again, all those numbers are coming down. Currently, we have 28 staff quarantined. Fantastic. I mean, we were above 150 2 months ago, down to 28 right now. And yesterday, our outpatient testing had an 11% positivity rate. You know, we have been, over the last 3 weeks, consistently below 20% positivity rate, which is down from the 35% we were seeing in October and November. So overall, everything is trending in the right direction from our perspective at Northwest. In regard to the remdesivir, which is the antiviral we've been using in combination with Decadron early on in a lot of the hospitalized patients, we have treated 683 patients for remdesivir, and we continue to have an adequate supply of that. As Casey was mentioning, the bamlanivimab, we have about 260 doses. So we've been able to get good supplies of that. And we're working with BSA and the Amarillo Public Health Department on the citywide infusion center. And my understanding is that we've treated about 150 patients here, and then that we continue to share, obviously, these supplies with the city to continue these infusions for those patients that qualify under the EUA. Right now, in terms of our PPE, we're in good standing, except we've had a relative shortage of small and extra large gloves. Now, just some kind of interesting numbers. Back in the first week in November, we used 750,000 gloves in 1 week. Okay, typically we are using 3,000 to 4,000 gowns per day in the hospital, right? And we typically use upwards of 395 masks per day in the hospital. So you can see why these supply chains for the PPE are so critical, because we burn through this stuff like no tomorrow. And then just lastly, my last thing today is I would like to personally congratulate Casey and Dr. Milton for receiving the Headliners Award from the Amarillo Globe News. Incredibly well-deserved. And the reason that we're in such good shape now is because of the incredible leadership at the city level and the public health department level to get us through this pandemic. So that's all I have. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
I'm good, David. Thank you, and good morning, Amarillo. I'm going to start off with a update of our BSA numbers and some statistics for us to process here. I agree with Dr. Weiss that we're starting to see what looks like a little bit of light at the end of the tunnel in terms of some of our numbers starting to move in the right direction. And we're hoping that that continues if we continue to be diligent with the things that we've been preaching now for months. Our total volume today at BSA is 326 patients. Of those 326 patients in our hospital, 90 of those have COVID-19. That's down substantially from where we've been over the past couple of weeks and couple of months. Remember, we had peaked at just over 200 patients when we went back a couple months ago and hit our overall peak for the entire year in 2020. Down to 90 at this point has allowed us to close some of our satellite ICUs that we had to open up because of the extreme burden on the hospital. We are still outside of the normal bandwidth of our ICU, which is historically 48 beds. We're still utilizing 70 ICU beds here at BSA. And the reason for that, obviously, is because of the total burden. We have 70 total patients in the ICU, as I just mentioned, with some additional capacity beyond that, despite closing some of our satellite units. Of the 70 patients in the ICU, 39 of those have COVID-19. For the COVID-19 patients in the ICU, 27 of them are on the ventilator. That's 75% of all patients in our hospital on the vent are due to COVID-19. We're also using about 51% of our ventilators currently. Our testing numbers have also come down. So similar to what happened with Northwest, we were in the 30% range, 34, 35% in October, November, meaning all tests that were done were coming back positive and a third of those tests performed. We were down to about 17% of tests being positive in December. And so far, January month to date, we're at 15% of our testing done at the hospital, which is where the bulk of this testing is done, are coming back positive. So that trend is in the right direction. In our urgent care center, in that full outpatient location, we're doing a high volume of tests there as well. And their testing rates running about 20% of all tests are positive. That's also down significantly from late December, where we were running closer to 30% of tests being positive. So that trend is also favorable. We continue to treat patients at BSA aggressively with the therapies that have shown the best evidence to date to help combat COVID-19, and that's dexamethasone, and that is remdesivir. They are at the forefront of our treatment. Beyond that, really, it's supportive care. It's giving oxygen as needed. It's trying to keep patients off the ventilator until the last possible time frame when we can no longer keep them off. And then also providing other supportive care as needed to make sure that we can minimize other complications. We know that the complications from COVID-19 have been significant, meaning patients are getting clotting disorders, patients are having sepsis syndromes, which are generalized infectious syndromes that have a high risk of mortality. So I can't preach enough about how important it is for us to, if you're a candidate for the vaccine, to get the vaccine, number one. If you're a healthcare worker and you still have not yet received the vaccine, I think you need to do a lot of careful introspection to decide why you're not getting the vaccine. And remember that previous infection does not mean you should not be vaccinated. Again, the immunity that you get from natural infection possibly lasts anywhere from up to 3 to 6 months. With vaccination, those are designed to give us a much more brisk immune response, and also to help with our T and B cell immunity and the subsequent responses we need to fight off infection, let alone these variants that we now are seeing across the world that potentially are going to lead to a recurrent severe infection. And that's the goal. It's also critical, again, for us to vaccinate as many people as quickly as possible, which is part of the reason why, we wanted to also support the city with their outstanding vaccination efforts. We can't comment enough on how great that effort has been to vaccinate as many people as we have, as quickly as we have in our region, which is really, I'd like to say, unparalleled from what we're reading about in other locations, what we're hearing about from our medical colleagues in different states, and also friends and colleagues throughout the state. So much credit to our city leadership and our public health leaders. As far as the monoclonal antibody, we've treated now over 340 patients at BSA locations with monoclonal antibody therapies. That's in addition to what we've been supporting the city with at the city site. So I think Amarillo, when you combine that with Dr. Weiss's numbers at Northwest, we are utilizing that resource very well here, and we need to continue to do so to try to prevent patients from getting severely ill when they are infected. From a vaccine standpoint, we vaccinated over 3,100 individuals. That's a combination of both first and second doses based on the timing of needing the second dose from our initial allocation, which was mostly Pfizer vaccine. And now we're dealing with mostly Moderna vaccine. And we did just receive our second dose allocation today in terms of what we need to do with lining up those people for scheduled doses and continuing with that plan and protocol. We'll be getting more vaccine, it looks like, in about another week to finish out those second doses, and we're waiting on additional information regarding first vaccine doses and working with state leaders. So again, things look like they're pointing in the right direction in terms of numbers coming down slowly. It does not mean we can let our guard down, as we've all said over and over. Please do the right thing in terms of attempting to social distance as much as possible, wearing your mask. If you have access to vaccine and you're a candidate, you're a healthcare worker, or you meet 1B criteria, you should get vaccinated. And the reason you wouldn't would be potentially a previous serious allergic reaction to the vaccine, which obviously then is a contraindication. So again, thank you for your time today. We appreciate leadership on this call. And I would also like to say congratulations to Casey and Dr. Milton for the award they received. It's well deserved.
Thank you, Dr. Lemonier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, Dave. Thank you. So I'll start with our numbers. Currently, we have 11 veterans hospitalized here in the VA hospital with COVID positive. 6 of those are in the ICU and 4 are on the ventilator. But I know what everyone's really wanting to know about is our vaccine. So here in the Amarillo, we've been given 2,200 doses of vaccine. We currently have given over 75% of that. Now that's 2,200 first doses. So I'm not counting the shipment we got last week for our second dose, which we begin today, because 4 weeks ago today is when we got our very first shipment of the Moderna vaccine. Our Lubbock has received 600 doses of the Moderna vaccine, and they've given about 60%. And we continue to do those vaccines every day. Veterans who are interested in getting the vaccine, if you are qualified, I would ask that please call. We are currently scheduling veterans over 65 or anyone with high-risk conditions to get the vaccine. We continue to make appointments every day for that. I do know some veterans have gone to the Civic Center to get the vaccine because of the outstanding program mentioned that Casey and Dr. Milton have set up there. And so if you've gotten it, just let us know so we can make sure we get that documented appropriately. One other thing that came out last week was the VA has authorized us to give vaccine to those approved caregivers in the VA caregiver program. And so what they have said is if there is somebody in the VA caregiver program, a caregiver, that they can get the vaccine at the same time that that veteran qualifies for the vaccine. So I know some of those veterans may have gotten the vaccine early before that was authorized. If you want to get the vaccine and you're one of those approved caregivers, please call our VA and we can get you scheduled. Or if the veteran hasn't been vaccinated yet, when you call, please let our team know that it's not just for the veteran, but it's also for that approved caregiver in the VA caregiver program. We want to make sure that we are getting those people vaccinated. And lastly, I just want to give a shout out. We had several staff come in on Martin Luther King Day, and then they will also be coming on President's Day to do a vaccine for our veterans. We were able to vaccinate 160 veterans that day. And so really appreciate the staff who gave up their holiday, not just this past one, but the one coming up in February to make sure that we can get veterans vaccinated. And so as always, I'd like to thank the city of Amarillo for this opportunity to talk to my fellow veterans, and have a great day.
Thank you, Dr. Gonzalez. Let's now go to City Manager Jared Miller. Mr. How are you today?
Doing good, Dave. Thank you. Just want to remind everyone that, as Casey said, our drive-through testing center is operational, and we are also currently today, at least, doing vaccinations at the Civic Center. If you want to be referred to the drive-through testing site, or if you have any questions about the vaccine or anything else that public health can help you with, call the Public Health Call Center at 378-6300. They can help you with a variety of COVID-related questions, along with screening you for the drive-through testing center. Also want to remind everyone that Amarillo City Transit is providing free transportation to anybody that needs to come to the vaccination center at the Civic Center or to the drive-through testing site so that you can get tested. To get a hold of Amarillo City Transit, call 378-3095, and they will schedule that transportation, both the pickup and the drop-off. We want to take care of you, make sure that there's no barriers, at least transportation-related barriers, to someone getting vaccinated or getting tested. We're currently operating under 2 primary governor's orders that affect us more than any of the others, and those are GA-29 and GA-32. GA-29 does require that we all wear face coverings when we are out and about in public. Can't say how important that is and how effective that's been in us driving the numbers down over the course of the last 6 weeks or so. So thank you to everyone that's been attentive to that. We're also under GA-32, which limits most of our businesses in town. While we are an area of high hospitalization, we still are, although we're getting closer and closer to being able to lift those restrictions, but we are still restricted to 50% occupancy at most of our businesses and most of our establishments. That's all I have, Dave.
Thank you, Jared. We're now going to go to members of our media. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with Kevin Welch, KFDA Channel 10. Kevin, how are you today?
I'm good, Dave, thanks. Casey, what will the procedure be to get second doses at the Civic Center?
So we will, it'll be very similar to what the procedure is for the first dose. So we'll have our lines, we'll have our screeners. We'll ask everybody to bring their card back. We do have contingency in case somebody doesn't have their card. We'll be able to look them up, but it'll just be very similar to the first dose. They'll just come and get that vaccine. If they don't, if it's too soon, then they'll have to come back a different day. So they want to make sure that it has been at least 28 days or 4 weeks since their first dose. So a good idea to check that the date checker on the AmarilloAlerts.com to make sure it's been 4 weeks from or 28 days from their first dose. But we do anticipate those shipments. Like Dr. Gonzalez said, we have already received our first batch of those second doses. And our first set of clinics were on December 28th. And so next week we will start giving those the first rounds of our second doses. And so come see us, check that date checker, and bring your card back.
Okay, and we're talking first dose and second dose. Is the second dose the same as the first dose, just a double up?
Yes, it's the exact same product. It's the same amount. It's the same of everything. It's just a booster dose so that your immune system is ready to go and ready to fight that virus if you are exposed.
Okay. And do you know how many doses the city has administered so far?
I can tell you that we have given just shy of 23,000 doses here at the City of Amarillo's clinic. I'll have to do some digging if you're asking about the larger community, but I can tell you we've given just shy of 23,000 doses here.
No, just the Civic Center. Are the hospitals having to divert patients still, or has it gotten so much better that you don't have to?
We are doing our best to not divert any patients, trying to stay off of diversion status as much as possible. The only issue would be ICU bed availability. As I mentioned, we're outside of the historical constraints of our ICU. We've expanded into our intermediate unit, which has been converted to a total ICU. And then we had some additional satellite intensive care units that are not ideal for long-term ICU care. And therefore, once we were able to move out of those areas with reducing numbers, we've done so. There have been a couple requests that have come from locations that are not typical for us to receive transfers from, and we evaluate those on a case-by-case basis based upon what our current bed status is at that moment in time.
Dr.
Yeah,
Wise?
actually, the same in Northwest, very similar. We were attempting to take everything from the region that we possibly can for a higher level of care, but we have had a day or two every so often where we've had capacity. We're at capacity for ICU beds.
Thank you. And is there enough of the therapeutic plasma available locally? Casey, I guess the city has a clinic for that. How about y'all supply?
Yes, so we're partnering with BSA in Northwest and couldn't appreciate their partnership more. And we do have, so that is based on an allocation from the state, and we do have an ample supply there.
Okay. And Casey, last week you talked about getting some demographics together. I know that you kind of have your hands full, but is that in the future coming?
Yes, I expect that for next week's press conference. So
Next week, okay.
More to come.
Thank you, everybody.
Thank you, Kevin. Let's now go to Dalton Williams of KVI Channel 7. Dalton, how are you?
I'm good, thank you, and thank you for letting me be on here and ask questions. The first one is, we kind of had a relatively good month in December, but we're starting to see like the numbers still slowly climb. So my question is kind of, what did we do differently in December that kind of helped us get a little bit of a plateau compared to now?
I guess I answer. I'm looking because December In December, the numbers were much higher than they are now. We've been seeing a steady decline over the last several weeks. And again, I think that was all part of that surge that really started in October, and then thankfully has shown some loss of energy, I guess, as of the late December now into January. But yeah, I think we've been trying to do the same things we've been doing continuously, is all the precautions. But I think part of this is just part of the natural cycle of this virus too.
Okay, and then next question is for Casey. With today being Inauguration Day, has any of the Biden team reached out to the city of Amarillo to talk about their plan of vaccinating 100 million Americans in the first 100 days of the Biden presidency?
No, we expect them to work with the states, and then the states generally work with the local health departments, and that's usually how that information flows. But we certainly work very closely with our state health department, and then the state would work with the federal team. And so we do have close working relationships with our state partners, and we serve on different committees and different ways that we work together. But as those transitions occur, then we know that we'll have more information and more interaction. But we expect that our state partners will work very closely with our federal partners.
Okay, and then what could the future look like under this administration with being more hands-on and wanting to vaccinate 100 million Americans in the first 100 days? Could that possibly slow us down or like ramp us up with vaccinations? Like, what, in your opinion, what could that look like for the city of Amarillo?
The name of the game over the last year has been flexibility. So we have changed, we have grown, we have done what we have needed to do to serve our community, and we will continue to do that. We don't necessarily know exactly what the next step is, but we know that we will be ready, and that we'll be ready for the challenge and the steps and whatever that looks like next. And we expect to stay with the science. We know that the vaccines work. We know that social distancing and hand washing and masking works. And so we're looking forward to whatever comes next, and to being true to ourselves. And that has been being very flexible and being very nimble, and to serving our community well.
Okay, awesome. Thank you so much. That's all the questions I have today. Thank y'all, and y'all have a great rest of your day.
Let's now go to Aaron Langston at KAMR Channel 4. Aaron, how are you today?
Pretty good. How are y'all?
Good, thanks.
First question is, do we have a number on how many people have been treated at the infusion clinic in downtown?
Last week we had just over 65, so I expect that number to have just gone up just a hair. So I would imagine just probably right around the 70 mark.
All right. And are we still seeing basically the same results from that? You said last week you had one person of those 65 that needed hospitalization.
Yes, so no change. And so those are really great results.
All righty. And how many more patients would you be able to see there? I know last week he was asking for more referrals and all that.
So we can see around between 8 and 10 a day, maybe a few more, but that's about our capacity. And so we haven't, we've been able to serve the number of patients that we've had referrals to, but certainly want to make sure that that physicians, that our medical community knows that we're taking referrals, and that our patients know that they can talk to their provider about the service, and that we are taking those referrals. And so that open dialogue between a patient and their provider is so important.
Okay, I think that has me covered for the day. Thank you very much.
Thank you, Aaron. Let's now go to David Gay of the Amarillo Globe News. David, how are you today?
I'm good. Good morning, everybody. Just a clarification, I believe, on a topic Mr. Welch brought up. Casey, for those second doses, I've had a couple readers reach out to me and ask if there's going to be any kind of separate line, separate space for those individuals getting the second dose. Is there plans on kind of having a separate space for individuals giving those second doses, or are they all just going to be in one space with the first doses?
So they'll be in the same line. We'll be in the same space. We're kind of using that like all of the Civic Center right now, but they'll be in the same space. We'll be able to note who is getting the first and second doses internally, but they'll come through that same line. We'll work everybody through that same space. Our vaccination team will be all together. That's why it's so critical that they bring their card back. Again, if they don't have their card, if it's lost or they don't have a card, then we'll be able to look them up in the M-Track system. We're installing those capabilities now for next week, so we'll be able to do that. But it will go faster if they bring their card, and but yeah, everybody will go through the same line.
Absolutely. And with, I guess, next week starting, individuals getting their second doses, as well as the potential of bringing new people in as more first doses of the vaccine come in, is there any worry or any thoughts on the Civic Center having more people than they can handle with combining the first doses and second doses of individuals in the community?
So we had very long lines at the beginning when we first started giving vaccine, and that has kind of tapered off. We're now, the vaccine is lasting a little bit longer in the week. I wouldn't say it's a trickle, but the lines are definitely shorter. And so I think that as we are giving those second doses, and then we're having just fewer people come for their first doses, but still we're having an interest in those first doses, I think that that's something that our staff can certainly handle.
And David, I would also add, we haven't yet really come close to the full capacity of what we can do at the Civic Center. We can handle so much more volume and so many more people than we currently are handling. We're very glad to be doing 1,500 a day, but we can do 3 or 4 times that many. If we get to a point where the state has given us so many vaccinations that we cannot use them at Civic Center, then we have plans in place to be able to open up additional sites. But that's going to take a significant increase in the amount of vaccinations that we have available to us. So we can absolutely handle the volume that we're projecting right now, barring some significant increase in the amount of vaccines that we're receiving.
Absolutely. Thank you for the clarifications, guys. Have a good rest of your week.
Thank you, David. That concludes our questions from our media today, and also concludes our news conference for today. We want to thank all of our panel who took the time out to provide this information to the Amarillo community. We appreciate it. Once again, this is David Henry, Communications Manager for the City of Amarillo. We'll see everyone next week. Thank you.
Thank you.